A 55-year-old woman's eyes turned red for months. The reason shocked her doctors. Hey friends, welcome back to the channel. If you are new here, we spotlight the most unusual and fascinating medical cases to raise awareness and spark curiosity about health and diseases. What if your eyes started turning red and no one could figure out why? That's exactly what happened to Mia, a 55-year-old Cambodian American woman. But the real shocker, the cause wasn't in her eyes at all. Stay tuned to discover the surprising twist in this medical mystery. Mia, our 45-year-old patient, had been living a normal life until she noticed something odd. Her eyes were constantly red, not just a little irritated, but noticeably and persistently red. For 6 long months, this unexplained symptom persisted. But that wasn't all. Mia also experienced dizziness that made her feel like the world was spinning around her. She also had vomiting and difficulty walking. She also had unexplained weight loss, and she lost more than 10 pounds in just 3 months. Initially, her doctors thought that it was just dry eyes and vertigo, but Mia's intuition told her that there was more to the story. As her symptoms persisted, her doctors decided to dig deeper. They ran some tests, and what they found was truly shocking. Her hemoglobin levels at that time were sky high, 19 to be precise, and normal is anywhere between maybe 12 to 14 for women. Her hematocrit was also extremely high, close to 57-58%, and normal is between maybe 36 and 45. But what did all this mean? What do you think caused Mia's high blood counts? A. Iron overdose, B. Dehydration, C. Blood disorder, or high altitude living? Alright, let's find out. After further tests, including genetic analysis that showed a JAK2 mutation, the verdict was in. Mia had a condition called polycythemia vera, a rare blood disorder where the body produces too many red blood cells. Her doctor commented that polycythemia vera can be very tricky to diagnose because its symptoms can mimic many other conditions. The red eyes Mia experienced were likely due to the thickening of her blood or increase in blood viscosity, causing small blood vessels to become more visible. Alright, now time for a quiz. True or false? Polycythemia vera only affects the elderly. Alright, the answer false. While it's more common in older adults, polycythemia vera can occur at any age. Did you know that polycythemia vera affects about 44 to 57 people per 100,000 population in the US? It is not a very common condition, but it's interestingly less common in Asian population, making Mia's case even more unique. We'll talk more about this later. Alright, time for quiz number 2. What is the main mutation that you can see with polycythemia vera? A. BCR-ABL, B. JAK2 V617F, C. BRCA1 or BRCA1, or D. EGFR. Do you know the answer? If you do, please drop your choice in the comments. By the way, did you know that polycythemia vera is a type of myeloproliferative disorder? Myeloproliferative disorders, or now known as myeloproliferative neoplasms, are a group of diseases where the bone marrow produces too many blood cells that are abnormal. This results in overproduction of one or more types of blood cells, such as red blood cells, white blood cells, or platelets. MPNs are chronic, often slowly progressing conditions and can lead to numerous complications such as blood clots or in some cases transformation into acute leukemia. Among the most well-known types of MPNs are polycythemia vera, essential thrombocythemia, primary myelofibrosis, and chronic myeloid leukemia. In polycythemia vera, the bone marrow produces too many red cells, although white blood cells and platelets can also increase. This results in thickened blood and higher risk of blood clots, potentially causing symptoms such as headaches, dizziness, and itching, especially after a hot shower, which is very weird. The elevated red blood cell count can lead to numerous complications like stroke or heart attacks if not treated properly. Essential thrombocythemia, or ET, is characterized by an excessive production of platelets. This raises the risk of both blood clots and surprisingly bleeding too. Individuals with ET may experience headaches, dizziness, or more severe complications like DVT or deep vein thrombosis, strokes, or even heart attacks. Despite the risks, Many individuals with ET can live without significant symptoms for long periods of time with appropriate management. Primary myelofibrosis, or PMF, on the other hand, involves the development of scar tissue or fibrosis in the bone marrow, which disrupts the production of all different types of blood cells. This, over time, can lead to severe anemia, fatigue, and an enlarged spleen, which can be pretty profound. PMF has a more serious prognosis as it can potentially progress into acute leukemia, aggressive and prompt treatment. Finally, chronic myeloid leukemia, or CML, is a cancer of the white blood cells driven by the presence of the famous Philadelphia chromosome, which causes uncontrolled production of granulocytes, a type of white blood cells. CML progresses through distinct phases, beginning with a chronic phase and can over time escalate into a more aggressive form such as accelerated or blast phase, resembling acute leukemia. Early detection and treatment with targeted therapies such as tyrosine kinase inhibitors, or TKIs, have significantly improved outcomes for patients with CML. Alright, now time for another quiz. True or false? Polycythemia vera can lead to an enlarged spleen. True or false? Let us know below in the comments section. As we said earlier, the global prevalence of polycythemia vera is pretty low, maybe 20 to 50 cases per 100,000 people, depending on the region and population studied. PV is a rare disorder and its prevalence is highest in individuals of European descent, with relatively lower rates reported in Asian and African populations. Like other myeloproliferative neoplasms, PV is more common in older adults, with most patients getting diagnosed above the age of 60. There is also a slight male predominance in the occurrence of polycythemia vera. Alright, now let's see how Mia's blood counts compare to normal levels. As you can see in this chart, her blood counts were significantly higher than the normal levels. Alright, once she was diagnosed, Mia's treatment began. The doctor started a procedure called phlebotomy, which is removal of her blood to reduce the blood counts quickly. She also started low-dose aspirin to prevent blood clots. Later, she started a medicine called hydroxyurea to control blood cell production in the bone marrow itself. The results? Mia's eyes redness improved. Her dizziness subsided and her blood counts normalized pretty quickly. 1 year after the diagnosis, she was thriving with no complications whatsoever. If you want to learn more about polycythemia vera, check out these resources right here. Mia's story reminds us that our bodies are extremely complex, and sometimes symptoms in one area can signal issues somewhere else. Always trust your instincts, and if something feels off, please don't be afraid to seek a second opinion. Thank you for joining on this medical mystery. If you found this video helpful, don't forget to like and subscribe for more fascinating health stories. Hit the notification bell to stay updated on our latest uploads. Next week, we'll explore the case of a woman with deadly complication following a medication error. You won't want to miss that. Stay curious, stay healthy, and we'll see you in our next video. By the way, have you ever experienced a medical mystery? If so, please share your story in the comments section below. Take care. Bye-bye.